Hi, I'm Bob McCoskrie and welcome to Family Matters. Vaccine mandates, vaccine passports, the no jab, no job policy for COVID, it's significantly affected us New Zealanders, both in workplaces, within families, for church attendance, social gatherings, even for those who were allowed to gather at your Christmas dinner table last year. Remember that? And perhaps the impact and effects of all of that continue to this day. A research paper was published in the British Medical Journal of Global Health earlier this year. It's a paper I couldn't find any media coverage in New Zealand on, although I'm happy to be proved wrong on that, but I don't think I am. And the paper was entitled, "The Unintended Consequences of COVID-19 Vaccine Policy, Why Mandates, Passports and Restrictions May Cause More Harm Than Good." And it surveyed 13 potential unintended consequences of vaccine policy in the areas of behavioural psychology, political and legal effects, socioeconomics, and the integrity of science and public health. Let me just read a quote from the summary. It says, "Mandatory COVID-19 vaccine policies have been used around the world during the COVID-19 pandemic to increase vaccination rates." It then says, "Our analysis strongly suggests that mandatory COVID-19 vaccine policies have had damaging effects on public trust, vaccine confidence, political polarisation, human rights, inequities, and social well-being. We question the effectiveness and consequences of coercive vaccination policy in pandemic response and urge the public health community and policymakers to return to non-discriminatory, trust-based public health approaches." Kevin Bardosh is a Canadian social and political scientist. He's an expert in global public health, an affiliate assistant professor at the University of Washington School of Public Health, an honorary lecturer at the Edinburgh Medical School, and has worked on Zika control in Haiti and on Ebola in Africa. And he's the lead author of the paper. Kevin, welcome to Family Matters.
Thanks for having me.
Now, I wish I could have you physically here in New Zealand as well. Perhaps we can get you down. Have you been to New Zealand?
I have not, no.
Okay.
I've never been down south there.
We'll put that on the wish list. Now, look, the first critique that will be made of this interview is that basically you and the other authors are basically a bunch of anti-vaxxers, right-wingers, misogynists, COVID deniers, every terrible term we can think of, and you're just full of misinformation and disinformation. So with that warm welcome, could you tell us, where were the authors from?
Yeah, I mean, so we're certainly none of the above of that list. And actually, I haven't heard much criticism along those lines. Obviously, this paper does insert itself into these broader conversations that have become very polarizing. And I would argue that the loss of nuance or the death of nuance during the pandemic has been one of the great tragedies that we've seen, including from the universities, actually, in terms of promoting critical debate. Both about the ways that different value systems approach a crisis from a different lens by prioritizing different aspects of risk, right, and life, basically. But then also the details around the interventions that we've used, whether they're lockdowns, mask mandates, or in this case, vaccination mandates. So this is a group of expert, scholars from Johns Hopkins, from Harvard, from Dalhousie, University of Toronto, myself. It includes, people who work on vaccination confidence for a living, social scientists who this is the bread and butter of, their work, is how can we increase trust and acceptance of vaccines and the positive impacts of vaccines. My work is not just on vaccination, it's on public health in general. Right. And that work is guided by an ethics of empowerment. How can we enhance human agency, human knowledge to make healthy choices and have healthy societies? And so I think the general sort of motivation of this group was that we were not seeing sufficient deliberation around the social harms of these policies. And there was a bifurcation, like a big polarization in the media coverage of vaccine mandates. If you think back to where the conversation started in the mid to late 2021 time period, established media outlets, left-leaning media outlets were very much on the side of pro mandates, pro passports, whereas right-wing stations were kind of nominally against, whatnot. And certainly with the new media ecosystem of the online system, which is not centrally controlled, I think there was a huge amount of opposition to mandates.
Yeah.
So what we wanted to do was to present a scholarly contribution to that debate, and sort of to outline the range of different effects or reactance effects, the way that people try to seek or to oppose what they perceive as coercive measures.
And how did you get such a great lineup of academics? I mean, my understanding, was it on Twitter that you gathered together originally?
Yeah, so this is the first paper I've ever written, which came out of Twitter relationships. So we, sort of found each other tweeting and finding each other, sort of liking the statements that we're making. And so then I thought, okay, there's nobody actually stating all of these arguments in one cohesive piece. And so I brought everyone together, and we worked on this starting in December of 2021. And then we finished the piece, put it up as a preprint, just as the Freedom Convoy actually was starting in Canada. And it was a very serendipitous moment there, right? And I would say that actually really reflects the fact that we were feeling the social pulse. And the paper sort of reflects the anxieties that were in the air, both on social media, but then also in our own social networks. Because I think every author on this paper, we have wide social networks in North America. We have diverse family members, pro-vax, anti-vax, the whole spectrum. So I think the paper, at least I can't speak for the other authors, but for myself, is really reflective of the broad social network that I have. And I pride myself on befriending people of different opinions, ideological backgrounds, et cetera. I mean, that's my job to some degree as a social scientist. So.
Now, you're on the border of Canada. Both Canada and New Zealand had a no jab, no job, and the healthcare worker mandates, which you've talked about in the paper, limits on church attendance, limits on social events. I mean, you've put in a couple of quotes, and I just want to refer to these. I mean, Justin Trudeau said about people who didn't want to get vaxxed or who were raising concerns, he said, quote, "They are extremists who don't believe in science. They're often misogynists, also often racists. It's a small group that muscles in, and we have to make a choice as a leader and as a country. Do we tolerate these people?" End quote. And just two quick video clips to show. The first one is of President Biden, a couple of years ago about being vaccinated, and then what some people say is a doozy of our Prime Minister, Jacinda Ardern, about being vaccinated. Let's just have a quick watch of those.
We are not fully out of the woods yet, because what is happening in America right now is a pandemic of the unvaccinated. Let me say that again. It's a pandemic of the unvaccinated.
So you basically said this is going to be like, well, it's almost like, you probably don't see it like this, the two different classes of people. If you're vaccinated or if you're unvaccinated, you have all these rights. If you are vaccinated...
That is what it is. So, yep.
Can you describe, as you were previously hoping not to have to do that, I guess, when we still looked like we could maintain elimination across the whole country? I guess that has now changed because...
I think it was less because necessarily of the elimination determining that, and more because we, of course, maintained, and actually we have managed very high vaccination rates generally without the use of certificates. But actually what it's become clear to me is that they're not just a tool to drive up vaccines, they're a tool for confidence. People who have been vaccinated will want to know that they're around other vaccinated people. They want to know that they're in a safe environment. It is a way that we can give confidence to those who are going back into hospitality or events. And so that is something that I think we should offer to people who have been vaccinated, that confidence that we're doing everything we can to keep them safe, and that they can come back out and start enjoying those things safely.
So that one of Jacinda Ardern about creating two societies, I mean, that really did shock quite a few people. And ironically, all these leaders caught COVID despite being vaccinated. So I guess it comes back to this question I want to ask. The promotion of vaccination was around stigma, the stigma as a public health strategy. That's not the normal way we approach health issues, is it?
It's not the normal way that we want to approach health issues. I mean, we don't make this argument in the paper, but the history of public health really does have these two different arms to it. And one is actually a coercive arm, right? If you go back and you think about food safety regulations, and the sort of colonial history of medicine, for example. There is this sort of harsh punishment-based ideology to public health. But the other one, which has really taken off with the HIV/AIDS pandemic, is this language of non-discrimination, non-stigma, right? And this is echoed in the way that a lot of our governments deal with drug users, with prostitutes, with people who are at increased risk of HIV/AIDS, right? And that has really dominated public health discourse for a long time. And I think one of the surprising things with the pandemic is suddenly that language of non-discrimination was kind of thrown out the window, and politicians used, this very polarizing language, these heavy hammers, and there wasn't a large opposition from the public health establishment. There was a lot of quietness, a lot of acquiescence to the policy initiatives. One of the frustrating things is that as I was following the scientific research in this area, it was quite clear that the vaccines were not durable. They were non-sterilizing, that you would get vaccinated and you had a high risk of being infected despite that. I mean, influenza vaccines are similar to that. And so there was knowledge that this was a very high possibility quite early on. And certainly in the US, we had statements made by the CDC and the Biden administration in September of 2021 or even before, saying, look, if you get vaccinated, you're not going to get COVID. We need to get vaccinated to protect each other, et cetera, et cetera. There was a lot of exaggeration. And even during that time, you could look at the data out of the UK or Israel, and clearly, if you were vaccinated, you were getting infected. So that's a big problem. I think in general, just the communication of uncertainty and honest, transparent communication has been lacking. And I think that that's also contributed to the sentiments of anger and the emotive elements of mandates, because not only do we have mandates, but we have mandates in the context where statements are not true, or there's sort of fuddling of the truth, which I think is partially driven this opposition to vaccination in general.
And I was going to ask you this later on, but why did so many health professionals and leaders buy into the coercive mandated model? Did we just panic a little bit? So, I mean,
I think we panicked a lot. I think that the whole pandemic was started. If we can remember at the beginning of the pandemic, there was a lot of fear about this virus. There was a lot of uncertainty. The images coming out of the media of, dead bodies, caskets from Italy, and then the sort of lockdowns that we had. And, a lot of that was legitimate. There's legitimate fear around the pandemic virus that we don't know about. I would argue that the fear should have, the fear barometer should have gone down quite a lot in May 2020, where we understood the age distribution of mortality and the relationship of comorbidities, but it didn't. And there's a lot of reasons, that I think that took place, having to do with the media and the way that a lot of social and cultural reasons. And I think people are still trying to sort of articulate that. So, I mean, I'll sort of mention an interesting conversation that I had prior to the COVID pandemic. I was involved in pandemic preparedness. I was involved in a simulation, for example, in London in late 2019, when COVID was already starting to spread, where we were trying to anticipate a global influenza pandemic and how different governments and stakeholders would respond. Right. And in as one of the only anthropologists there, I remember somebody saying to me, you're an anthropologist, you have some really unique expertise. And what I want to know is, why do people panic so much during a crisis? Because there's the health crisis, but then there's the panic crisis that's related to that. So this notion that panic creates its own sort of pathology during a pandemic, I mean, people know that in global health, in health authorities. And I just think we've really struggled with communicating, that anxiety.
Okay, so in your paper, you've looked at potential harms that came about from these mandates and the no jab, no job type policies, and they're under the headings of behavioural psychology, political and legal effects, socioeconomics, and integrity of science and public health. So could we go through just each of those headings
Sure.
one at a time very briefly? So firstly, behavioural psychology, you've talked about reactance and entrenchment, cognitive dissonance, stigma and scapegoating, and conspiracy theories. What do you mean here?
So yeah, I mean, there's a lot to chew on here, right? I mean, behavioral psychology is a massive area of research. And I think what we tried to do is to summarize the studies that exist and so some of the concepts that can be useful to understand how people respond to these particular mandates. So reactance is the notion that if you're going to try to take away my freedom, and I'm going to try to reassert myself, my dignity of personhood or my liberties in another way. And of course, if I feel like the effect on my freedom is not justified, that resistance is going to be increased, right? Right. So I think we've certainly seen that. And I mean, going back to my statement about public communication not being fully transparent or truthful, right? That further drives reactance, because people will say the government is not telling us the whole truth. They're lying. What else are they covering up, right? Oh, well, now we shouldn't believe studies on the efficacy of the vaccine, or they're hiding the adverse effects data, et cetera, right? So it creates further sort of entrenchment of distrust in authorities. And obviously, this is something that as a society we've been dealing with for a few decades now, the whole sort of crisis of experts. And I would argue that at least in the United States, that really took off post 9/11, where we also had a situation where the government was not truthful about foreign interventions. In this time, foreign interventions, not a pandemic. The second component here is cognitive dissonance. So that's the notion that there's a lot of conflicting information that's out there, right? And people are trying to make sense of that. And when they perceive untruthfulness, right, that's further going to entrench. It's a component of entrenchment, and so it's going to further their distrust process. I mean, I kind of already explained that a little bit with the other concept.
Although interestingly, New Zealanders were told that the government was the source of all truth and not to believe any other.
Free to visit at any time to clarify any rumour you may hear. covid19.govt.nz. Otherwise, dismiss anything else. We will continue to be your single source of truth. We will provide information frequently. We will share everything we can, everything else you see, a grain of salt. And so I really ask people to focus on that.
Yeah, I think that's this week, right? There was also a quote in the media about truth. Yeah. I mean, this is a fascinating idea, right? That the government is the source of truth. I mean, historically, yes, the government can be a source of truth. It can also be a source of falsehood. And I mean, there's a lot to say about that whole movement of kind of a sanitization of truth, right? And also a notion that truth is easy to locate and to hold on to, right? Like, who has the truth? It's a very arrogant thing to say, well, we have the truth. There's a lot of different, there's a lot to say about that.
Oh, exactly. I mean, that's all part of democracy, isn't it? The civil discourse of debate of ideas.
Exactly. And the idea that debate produces better ideas because we're challenging each other, and that is part of the open society. Yeah. So I think that, there's a lot of theoretical conversation about this previous to the pandemic, the whole notion that we're entering this era of what Zuboff, who's a professor at Harvard Business School, calls surveillance capitalism. So the idea that online tech companies have astronomical amounts of power to shape our perceptions and our notion of truth. And I think we've seen a lot of those ideas kind of pan out in the pandemic itself.
Well, that comes into the second category that you talked about in the rise of the anti-vax movement. But although what fascinated me was that there was some people who just did not like vaccines, full stop. But then there was a middle group who weren't anti-vax, so to speak, but they just were cautious about whether the vaccine was a solution to COVID. And they still hold that genuine opinion. So that has been a major. I mean, you've talked about disunity in global health governance, haven't you?
Yeah, I mean, the disunity in global health governance is a separate concept there. And that's the way that these mandates, so the paper was written as the mandates were starting to take off, right? They've kind of been rolled back as the Omicron wave kind of swept through. And so at the time, there was an idea, we were starting to see conversations about mandatory vaccination in African countries, for example, and a lot of other places in the global south where they didn't have enough even supply of vaccines. And also in the African subcontinent, there was already a lot of prior infection, right? And an idea that you had lower mortality because of, for one hypothesis, is more cross-reactivity with other coronaviruses, and there's lots of explanations for that. So the idea of that was, what would be the relationship of mandatory vaccination with development loans, where global financial institutions could say, well, okay, we're going to give you these loans that you need to keep your economy afloat, but you need to implement these mandatory vaccination policies or other COVID restrictions. It was more of a hypothesis. I mean, it's really hard to actually get data on that type of negotiation. And I also think that the pandemic, Omicron, has presented a completely different situation from an epidemiological standpoint. I would say if we didn't have Omicron, hypothetically, let's just say that the vaccines actually were better at stopping transmission, right? I think we would still be living with passports to get into coffee shops, workplace mandates. I mean, I don't think that these would have been dialed back anytime soon. It's actually quite a frightening idea, right? Like, how long would we exclude people who refuse to be vaccinated from work, from social life, from travel?
Well, we still are doing that in New Zealand in some sectors.
Okay, right. Yeah, I mean, there's also still regulations like that in Canada that are still in place as well.
And you couldn't come to New Zealand if you weren't vaccinated. We still would stop unvaccinated at the border.
Right, and it's the same as in the United States as well, and in Canada it's the same. It's the same thing. So I think we saw this kind of machinery of exclusion, like the quote from your prime minister, right? This tiered society, this two-tiered society based on biological status. And it was quite worrying to see how quickly that came about. And I think in one way, some of my work at the moment is trying to question, the mechanisms, the social mechanisms and political mechanisms that put that into place, because I think we could have a situation in the future where that becomes semi-permanent, right? If you don't comply with the medical mandates, this is going to be now the sort of new normal, right? And that's the quotes that we sort of used at the time to describe that. And I actually, so this whole paper, I had a family member in late 2020 who said to me, Kevin, they're developing these vaccines. Do you think they're going to make them mandatory? And I said, no, I think we had these lockdowns, absolutely. I don't know what happened to public health. We kind of we threw the rule book out in terms of this notion of empowering people and trying to reduce fear and trying to, not disrupt society, but still to address the virus. I'm not saying that we shouldn't do anything. And they were right and I was wrong. And so I've been eating my words since then. So I'm more humble with making predictions about the future after that one.
Now, you also talk about disparity and inequality, and there was an opportunity cost that we call it in economics, where the whole focus was on the vaccine, but there was a reduced health system capacity. People were being excluded from work and social life. Talk to us a little bit about that, because I guess that's where you're talking about the harm from what was perceived to be the good of the vaccine.
Yeah, I mean, I think the harms have been significant for some individuals. I mean, they've been fired from the jobs, they've lost their career for taking a stance. And some of the time those are, I would say, we don't really have data on this, but personally, I know people who are very pro-vax who just basically said, I don't agree with the way these policies have been rolled out, and I'm going to oppose them for that reason, right? So that's a position of conscience where you just don't agree with the level of government intervention and the precedent that this sets for the future. And those individuals have lost their livelihoods, and there's a huge reputational damage, I think, in general, with opposing mandatory vaccination, because we live in a society where vaccines are a totem. They are considered to be wholly good all the time. This is a very general statement, but vaccine science and vaccinology is complicated. We need cost-benefit analysis. We should have cost-benefit analyses considering also the side effects of vaccines that we take into account, et cetera. And I think a lot of people feel that those standards have been somewhat eroded during this process of authorization. So, for example, in the United States, we have booster mandates right now for university students and college students, so 18 to 24-year-olds plus. About 300 universities and colleges say in this fall, if you don't have a booster, so if you don't have your third vaccination, you're going to be disenrolled from your studies.
Wow.
So, if you look at the actual data around, what's the actual public health benefit of boosting 18 to 24-year-olds, most of whom have already had COVID as well, and we know hybrid immunity provides more protection long term. Is that justified from a public health standpoint? And I would argue that it's not. And yet, how many students are going to be disenrolled? How many parents and students are fighting, about this issue, debating it, discussing it? It's causing psychological sort of, I don't want to use the word trauma, but people are having to wrestle with these decisions. Do you comply with it or not? And so I think that, and that's just one example of the difficulties of these decisions that are being rolled out. And I don't think, at least in that case, there is obviously a recognition that there is a risk with myocarditis. Now, it's relatively rare. We have a lot of studies on this. But when you're talking about that particular age group, how many hospitalizations are you averting from boosting a university campus? And what is the potential for cases of myocarditis, let's say? That's actually a calculus that I'm in the middle of working with some colleagues.
So that leads into the final category where you talk about the erosion of key principles of public health ethics. What do you mean by that?
Yeah, so one of those is the notion of proportionality. So, which is the idea that you're not going to impose, so in this case, mandate vaccination, where the harms are greater than the benefits. Right. And the benefits need to be clearly defined. So if the vaccine, if our current non-sterilizing vaccines were sterilizing, so they prevented transmission durably for a long period of time, then a vaccination mandate could be ethically justified, at least on more sound ground. Okay, it wouldn't run against the idea of the proportionality test. But our vaccines are not doing that. So it's like we still have these policies that are in place with a flawed assumption. And the vaccines do have some effect on reducing transmission, but it's short duration, and it's unclear, how that weighs with individuals who have prior infection. And that's another issue, which is that in all of these mandate policies, we've essentially neglected the people who had COVID, survived, and recovered. They've just been completely excluded from this whole conversation, to the point that they've been fired from their, there's firefighters and policemen just locally in the area that I live in who were fired from their jobs, and they had COVID. And they just said, "Oh, I've looked at the data, and I think I probably have some immunity now. I'm okay. I don't want to get vaccinated for whatever reason, and I'm okay with that." And then their employer says, "No, you're going to need to get vaccinated anyways because we don't recognize prior infection." And there's also been a reduction in general exemption criteria, and also the reasonable accommodations. So, for example, you could have a weekly test, as a compromise, let's say, instead of getting vaccinated for a certain period of time. So the idea of having these accommodations to factor in the complexity of people's, history, their experiences, their perceptions, their values, etc.
Now, interestingly, we did a campaign towards the end of last year talking about, it was called Don't Divide Us, and it was about, for those who are unvaccinated, not to lock them out of jobs and churches and family events, but it was to offer the option of rapid antigen testing, which in New Zealand is now the gold standard. I've just come back from overseas and I got my pack of rapid antigen tests and I'm supposed to be testing myself regularly. We know that COVID targeted primarily specific groups, the elderly and the compromised. Did we all need to be jabbed? Because
that's a great question.
The argument was that we would therefore protect the vulnerable, and that was why the health sector had the mandate, because you were hanging around vulnerable people just by working in a hospital.
Right. I mean, there's different opinions around this. We obviously have a big debate currently about children, right? So 5 to 11-year-olds, or even in the US, we've authorized vaccines for 6 months to 5-year-olds. And there's competing sort of camps. I would say that there was a detraction or distraction that occurred when we said everyone needs to get vaccinated. In a lot of contexts, I wonder how many elderly people didn't get vaccinated because their family members were angry, let's say at the mandates, for example, right? And they influenced their family members not to be vaccinated. Also, there's been a very strange lack of conversation about supportive treatment. So if you have COVID in the United States, there's no COVID hotline that you can call. It's very hard to get any treatment or any supportive care, right? Just basic things like a steroid or an antibiotic if the infection moves to your chest. And it seems to me like we kind of threw that out of the window. And I have sort of been contacted by people with these horrendous stories of just trying to get antibiotics for a COVID infection, or the monoclonal antibody treatment that's available.
Well, and in New Zealand, we had a delay on the vaccine coming in because we were promoting the lockdowns where, we were trying to get to zero COVID. And so we mucked around a little bit about getting the vaccines in. So it was very slow. But the problem is that when people spoke up in any way and tried to get some debate around what was the most effective approach and could rapid antigen tests be an alternative, and did everyone need to get vaxxed, and should we just target it at the most vulnerable who did need to be vaxxed and who obviously got benefit from it, it was immediately labelled dissent. It was labelled misinformation and disinformation, anti-science, right-wing. And yet your paper suggests that this actually exacerbated the problem, the whole ramming down the mandate. It actually made the problem worse.
Yeah, I think people have grievances now against public health and against vaccines in general. And I think we're possibly seeing a reduction, let's say, going forward in childhood immunizations, in just general trust of the medical establishment, in trust in our scientific institutions and government. And I do really think that there was a different way to do this. But it's like our sort of primitive fear-based mind had taken over from a very early stage in COVID. And we had this notion that we had to maximize suppression. I think it's hard to talk about the vaccine mandates without talking about the lockdowns, because I think there's obviously a complete relationship in the ideology or the way that public health was conducting itself, moving from lockdowns to vaccine mandates. And I mean, just the notion, getting back to the earlier point about does everyone need to be vaccinated, the idea that everyone in society is going to accept a medical intervention, whether it's a vaccine or other medical interventions, there's always going to be social groups who are going to oppose it for lots of different reasons. Social life is complicated. Humans are complicated. And the principle of constitutional democracy is that we respect those differences, those civil liberties. We respect the general principles of freedom of expression and the ability for you to conduct your life according to your own value system, unless it's impinging on the freedoms and the constitutional rights of other individuals, right? So we obviously do have limits on those freedoms. And I just don't think that the case was made in this specific instance to limit those freedoms to such a draconian way of locking people into homes. And I mean, if you think about in Austria, they had segregated lockdowns where all the unvaccinated people had to stay home, right? And again, we might say, oh, well, it wasn't so bad because look, now society is reopening. But getting back to my earlier point, if the vaccine was more durable and God forbid, let's say that the virus had a higher mortality rate and affected younger people, we would be living in this sort of very different reality. And hopefully in those circumstances also, I think that more people would actually get vaccinated because they would see that benefit for other individuals. Yeah. But even in that instance, is sort of the sort of name calling strategy really the most effective approach there? I think that there's strong evidence to suggest that it's not. And in the long term, you are creating resentment. And I'm very curious to see what happens to vaccination rates. I mean, with influenza vaccine in the United States, about 50% of people get the annual influenza vaccine. Right. So we do have a high trust in these annual vaccinations. Even in the case of influenza, actually, the vaccine is not always very effective. Sometimes it's like 20% of vaccine effectiveness, and depending on the strain that they're able to get that year, it's an imperfect science. So we'll see what happens with the COVID vaccines going forward.
I did look through the paper, and I may have missed it, but one of the key arguments was that the vaccine would reduce hospitalization, and that was a key for not overburdening the health system. Was that a good argument for vaccination mandates because it would reduce hospitalization?
Yeah, so that was one of the other arguments that was made for mandates. We kind of moved from the beginning, okay, the vaccine's going to stop transmission. Everyone needs to get vaccinated for that reason, stop transmission. And as that sort of became a little bit fuzzy or gray, we moved to this idea of we have to prevent the hospital system from being overloaded. I mean, I think in some cases, I haven't seen data to support that hospital systems were really in danger of being overloaded. In sort of late 2021, in 2022. And I think that there are also questions about the way that this discourse obfuscates the need to invest in public health in general. So if you're having an overloading, like for example, in the UK, every year during influenza season, the NHS is almost overwhelmed with cases because the beds are kept at such a maximum level, right? So if the hospital is overwhelmed, well, maybe we need to rethink our capacity for hospitalizations. It's one, and certainly going forward with COVID, we're going to need to kind of inspect the privatization of hospital systems and the fact that a lot of these systems have been underfunded for decades. So I don't think that argument was shown to be correct. If you look at a lot of the epidemiological data, you might be able to find certain regions or places where hospitalizations was a concern. And obviously that is one argument that people would make. I just don't think that really stood the test here in this instance.
I mean, it was fascinating because I was looking at the timeline of New Zealand, and we went into a couple of lockdowns. And I live in Auckland, and we had an extra one on top of the rest of the country. And I was looking at the justification for going into the lockdown, and it was less than 10 infections. In fact, I remember we were following this particular infected person as they travelled up north to find out if they were infected or not. Yesterday, I think we had around 8,000 new infections. We have about 800 in hospital, and I think it was around 10 to 20 deaths that they would attribute to COVID-19. And yet people just say, the media just report that as matter of fact, and then they move on to the next story. So has the science changed? Has the politics changed? Has both changed? Or have we just normalized and got used to it and we're moving on?
Great questions. I mean, the media has played this very strange role, and it's the same thing here where I live in the greater Seattle area. I mean, the local newspaper will say COVID cases are up 50%, and it's a few dozen cases, or the hospitalizations are up 50%, and it's 6 additional people. And then how many of those were they're not primarily in hospital because of COVID. They have another condition, and that's why they're there. So I think there's been a failure of the media to appreciate the damage of the panic cycle that they perpetuate, and that they've perpetuated throughout this crisis, in many instances, by focusing on cases and sort of ramping up the emotive language around it. I do think we are in a difficult position with this virus. COVID is not always a benign virus, right? I've had it twice, maybe 3 times. We are going to catch this virus going forward, right? So what does living with COVID mean? I mean, I think we're still struggling with that to some degree. And certainly the research on long COVID is also being hotly debated in the scientific community and in the press. That is something that I feel some sympathy with. I know that viral infections do have long-term effects for some people who get them. I've witnessed that myself in my work. Yeah. So I'm not downplaying the severity of the virus, but I am questioning, what I call COVIDization of society and of governance, right? We're constantly just seeing the social world through this one virus. For example, here where I live, town county meetings are still on Zoom, so we cannot go and voice grievances to our local government in person still, and we're over 2 years into this pandemic, so we've given up a lot in this fight. I think a lot of people have also followed the rules for long periods of time. They've been good citizens, and this whole language that if we just locked down harder, if we masked harder, if we just vaccinated more people, we outed the crisis. It's just not true. We have to learn how to live with this virus.
2 final questions. In the paper, you say rather than being a coercive, the mandates, the no jab, no job policy, you argue for pro-social language and community leadership. Can you just expand on that?
Yeah, so I mean, that's the traditional idea that you are promoting vaccination for your own health, let's say, or to address the transmission dynamics in the community. So it is essentially building trust between people where they live and their local nurses, their local doctors, their local community healthcare workers, and also tailoring that conversation to the particular health status of the individual, to their concerns, listening to those concerns, and entering into a dialogue with those individuals, and promoting, the open and transparent communication or information exchange between providers, medical providers, and patients. So we don't outline all the different specific strategies in the paper, because the paper itself is focused on outlining all of these potential unintended consequences. So I'll kind of leave it at that for the moment.
Yeah. Just finally, I didn't find any media coverage in New Zealand. I'm pretty sure there was none. And I couldn't find much internationally. What was your paper effectively ignored? Was it deemed to be misinformation and disinformation?
I don't think the paper's been ignored. It's been certainly shared a lot on social media. But it does raise a lot of uncomfortable points. We do state in the discussion, we ask the question, will the public health community come to acknowledge that this particular approach was too too strong, right? Whether the coercive element had these negative externalities, these social harms. And I think we're not necessarily seeing that acknowledgement. And so, for example, all the universities in most of the universities in North America mandated COVID vaccinations, right, for their students who are relatively low risk population. And if you objected to that, you were some universities had an opt-out system or an exemption system, but a lot of students got disenrolled, et cetera. So I think it's going to be interesting to see the way that the conversation evolves in the future down the road. And I think I hope that we don't see a massive, noticeable drop in basic childhood immunizations because of this, but it is one of the hypotheses in the paper amongst many others.
I mean, I just thought, you had, universities of Washington, Edinburgh, Oxford, Toronto, Harvard, John Hopkins, London School of Hygiene and Tropical Medicines. I mean, it was, it's a stellar lineup of authors. This is a heavyweight paper in my view. And so I'm just sorry that it hasn't seen the light of day, especially in New Zealand, as we, you know, I mean, families have been majorly impacted. People have lost their jobs. Mandates are still going on. Borders are still semi-shut. We're still tackling this issue, and your paper should be part of the debate, but unfortunately it's not. So hopefully this episode will highlight it, and we'll put a link to the paper in the descriptor, and people can read your paper for themselves and draw their own conclusions. But Kevin, we're out of time. I really do appreciate your time. Thank you for your availability, and all the best for the future.
Thanks for having me, and it was a pleasure to be on your show.